For most of human history, mental illness was not understood as a medical condition. Strange behavior, hallucinations, or severe emotional distress were often blamed on demons, curses, or supernatural forces. And when people didn't understand suffering, fear often became the treatment. As centuries passed, early doctors began searching for medical explanations. But the road toward modern psychiatry was far from peaceful. In the 18th and 19th centuries, psychiatric asylums were created as places where people with mental illness could supposedly receive care. Yet, many became overcrowded institutions where patients lived in terrible conditions, isolated from society, and sometimes subjected to harsh discipline. Then came an era of experimental treatments. Doctors tried methods that were believed to control severe mental disorders, including prolonged sedation, hydrotherapy, and other aggressive procedures. Some treatments were introduced with genuine hopes of helping patients, but the limited scientific understanding of the brain meant that mistakes could have devastating consequences. The 20th century began changing everything. Researchers started uncovering the complex relationship between the brain, behavior, and mental illness. New medications emerged, psychotherapy developed, and psychiatric care gradually moved away from institutional confinement toward more individualized treatment. But this history teaches us something important. Medicine doesn't always get things right the first time. The darkest chapters of psychiatry were shaped by fear, misunderstanding, limited science, and sometimes the belief that suffering could justify extreme methods. Today, mental health care is still evolving, but compared with the past, patients have something that was often missing before: greater understanding, scientific evidence, and recognition of their basic human dignity. The history of mental health treatment is disturbing, but it also shows how far medicine can progress when knowledge replaces fear.